Okay, everyone, thank you so much for joining us today. My name is Larissa Kriwak. I'll be your WebEx moderator for today, and that just means I'll be working behind the scenes as your support host. Before we get started on today's presentation, I'd like to go over a couple housekeeping items. We ask that you mute your line to avoid any background noises to allow greater engagement. And please submit any kind of technical questions or issues you might be experiencing through the chat box. Your host of the webinar, that would be me. I am also under Jennifer Schaefer too. During the Q&A portion, throughout the presentation, if you do have questions, please use the chat box. And during the Q&A portion, a moderator will read your questions on your behalf. If you do not see the chat box or the participant panel, you may need to activate the appropriate box using the lower navigation panel found at the center of your screen. And please note we are recording this webinar, and slides for the meeting will be posted a little bit later, probably around 3 weeks. Again, please remain muted during the duration of the webinar to avoid background interruptions. And again, if you need any technical support, I'm happy to assist you. And now I would like to introduce Dr. Kelly Blake and Dr. Gurvanit Randevan.
Thank you so much, Larissa. Are you going to pass me the ball? I think I have it. Well, welcome everybody. Thank you so much for joining. I'm going to just go back to our top slide first. So you've tuned into a pre-application webinar for a notice of special interest on telehealth and cancer care. This is NOTCA 21043. That is sponsored by the National Cancer Institute. And this is actually a companion announcement to RFACA 21029, which is a centers initiative, Centers on Telehealth Research and Cancer-Related Care, which utilizes a P50 mechanism. We're not going to discuss the P50 RFA today. This presentation is solely focused on the NOSI for telehealth and cancer care. So first, I think it might be useful to start with some definitions for applicants who are interested in this area. CMS defines telehealth, telemedicine, and related terms as generally referring to the exchange of medical information from one site to another through electronic communication to improve a patient's health. And HRSA extends that definition to include the use of telecommunication technologies to support distant clinical health care, patient and professional health-related education, public health, and health administration. And these definitions are the ones that NCI uses when we look at telehealth applications. So as everybody knows, telehealth has increased due to COVID-19. There's been a spike since the onset of the pandemic, and while that spike is currently plateauing, usage will likely not return to pre-pandemic levels, and so this is an excellent opportunity for research in this domain. There are motivated patients who are willing to seek out alternatives to in-person visits, and there's reimbursement flexibility with virtual visit billing being comparable to in-person visits, and patients in many cases being able to see doctors who are licensed in other states. And if you're tuning into this webinar, you already know the potential benefits of telehealth and cancer care, including, cancer-focused telehealth, improving healthcare access and quality, patient-provider communication, and health-related quality of life. And we want to be really specific to say that with this NOSI, the scope actually encompasses both synchronous and asynchronous interactions. So both real-time and sequential applications will be considered in scope. The scope also includes both patient-provider and provider-to-provider interactions, and we're going to go through some examples of those a bit later. Patient interactions in this definition and for this NOSI can include interactions with family members and caregivers, so it's a really broad range. And we're also accepting applications that look at the impact of telehealth across any point of the cancer control continuum from prevention to end of life for all patient ages and delivered within all care settings. All of those are within scope for the NOSI. Just some examples for the patient-provider research that we're looking for. Certainly, applications can include these topics, but many more as well. This is not an exhaustive list, but applications that examine the utilization of and evaluate the effectiveness of telehealth for primary and secondary cancer prevention are really of interest for this NOSI. So counseling for tobacco, alcohol, physical activity, diet, HPV vaccination, and mental health, all within scope. Applications that provide genetic counseling for germline mutations are within scope. Applications for, that provide shared decision making for preference-sensitive cancer screening tests, and those that seek to improve adherence to cancer screening are all considered within scope. In addition, applications that seek to evaluate the effectiveness of telehealth interventions that aim to increase cancer screening rates overall, improve the accuracy and timeliness of cancer diagnoses, and initiate appropriate cancer treatment. We think telehealth can be beneficial in all those domains and are interested in applications in those areas of screening and treatment. Those that seek to evaluate the effectiveness of telehealth in improving treatment and management of cancer and or the provision of palliative care would be in scope. Those that evaluate the use of telehealth to support cancer survivors, including surveillance of adverse effects of cancer treatment, recurrence of cancer, and treatment of comorbidities, all within scope for telehealth intervention applications. And as well, in terms of the patient-provider research domain, applications that are specific to the processes of telehealth. So those that seek to understand the tasks and the time and cognitive burden associated with performing the tasks that are imposed by telehealth interactions on patients and their caregivers. And so next I'm going to turn it over to my good colleague Gurvanit Randhawa to discuss the provider-to-provider research examples and finish out the webinar.
Thank you, Kelly. And hello again, everyone. This is Gurvanit Randhawa. I'm in the Healthcare Delivery Research Program. And Kelly and I have worked on this announcement, so we are very happy to see this interest. So I will go through some of the examples on the provider-provider interactions. That is just to give you an example of the scope of our NOSI, and it is by no means limiting you to just these examples. So the first one is evaluating the effectiveness of telehealth in improving communication and coordination of oncology care. So here we recognize that often there are challenges in communicating not only within the oncology care team, whether it's radiation oncology, medical oncology, surgical oncology, and with oncology nurses or with patient navigators. So we recognize those challenges. But also, equally importantly, there are interactions between oncology care and primary care. So we have called that out, that our NOSI includes communication and coordination between oncology care and primary care providers. We also understand and realize that there's a rapid proliferation of genetic and other biomarker tests for precision oncology. And this is an area where telehealth can really help support delivery of care. So another area that we would like applications to come in for is to evaluate the effectiveness of telehealth for precision oncology, including the use and interpretation of tests for genomic or other molecular markers. We realize that not just telehealth, but IT systems in general can disrupt the clinical workflow and impose a cognitive, time, and other burdens on the providers. So one of the areas of emphasis is to better understand the clinical workflow and the cognitive and other burdens imposed by current clinical information technology systems on the providers in their telehealth related interactions. And finally, just another example is in terms of multi-level thinking, we also realize that where the practice team resides, the organization that they are working in, the policies of their organization, the interactions of the team, and the configuration of IT systems, they all influence the workflow. So any applications that help us better understand how organizational policies, clinical team interactions, and the configuration of IT systems and their influence on the clinical workflow and delivery of telehealth is of interest to us. Okay. And One thing that I just want to stress, we have it in the NOSI, but it's worth stressing again that we have a focus on inequities and disparities. That NCI encourages telehealth research in populations that experience inequities in access to care, have limited access to broadband and digital technologies, and have low health literacy or low digital literacy or both. And they also, if they have worse cancer outcomes compared to general population, we encourage telehealth research in this population as well. So studies that examine telehealth in the context of community oncology practices, including those in rural areas or those serving underserved populations, is encouraged. Research that examines how telehealth can be implemented without exacerbating health disparities, as well as research that examines how telehealth can be used to reduce health disparities and promote health equity, is encouraged. We also wanted to set, so we have both Kelly and I have said it's a NOSI with a fairly broad area of research, but we also wanted to convey to you that there are some guardrails around this. And so examples of non-responsive topics are that studies that examine only the aspects of patient self-management without any interaction with an oncology care team, stand-alone mHealth studies, web-based interventions or decision support tools that do not have an explicit connection with care delivery, and studies where the focus is on the development of new drugs or devices. Those would be considered non-responsive topics. In terms of study designs, again, we have a very broad net for this NOSI. Observational, interventional, or a combination of both study designs is within scope. The studies may examine interactions or the interventions at one or more levels. That is, could be at the patient level, the provider level, or the system level. The R21s that may come in for this NOSI may support formative work to develop telehealth interventions or to examine their impact in pilot studies. The R01s that may come in here would be supporting evaluation of interventions in a cancer care delivery context and identifying the aspects of telehealth that are being tested in order to isolate their effects on variability in specified patient outcomes is encouraged. For your application, when you submit it, you need to choose the FOA from the list given below. So we have 4 PARs we have listed in the NOSI. And one thing to keep in mind is to check box 4B of the SF424 R&R form. That will give you, and another thing to keep in mind is that once you click on the NOSI and the PAR, there may be different receipt dates for the PAR. So please keep that in mind. They're not all of the standard receipt date. Here I'll also give you an overview of some of the questions we've already been asked. And they come in 3 different themes. The first one is, where will the applications be reviewed? And the applications to the NOSIs, they're not being reviewed by any special emphasis panel, and there are no set aside funds for these applications. So the standing study sections and the existing funding within the RPG pool would be used for the applications. For applications with a foreign component, our advice is that foreign components are discouraged because of the unique healthcare and telehealth context in the US. So we would really like to see a US healthcare delivery focus here for these applications. And the third theme is, can you apply to an FOA that is not listed on the NOSI? So if you are coming in for the NOSI, you need to list and apply for one of the 4 FOAs that are mentioned. So either the ones that are listed here or those that may expire and will be reissued in the future, you need to come in through those funding opportunities. So again, I'll provide our scientific contact. So I'm Gurvanith Randhawa, and Kelly Blake is my colleague. We are the 2 people responsible to help you with your scientific questions. And I will come to the end of my talk. So thank you again for your interest. And we really look forward to your applications. Thanks.
Thank you, Kelly and Gurvanit. My name is Mimi Lissing, and I will be moderating the Q&A portion of this webinar. We do encourage you to submit your question in the chat, and I will share your question with our speakers to respond. So to start, we just want to let you know that the webinar recording, as well as a copy of the slides, will be archived on the webpage URL that you see on this slide in approximately 3 weeks. In addition to the recording and the slide deck, we also will be developing an FAQ that will accompany these two materials, and it will list some of those common questions that Gurvanit had mentioned, as well as some of the questions that we'll be discussing today. The first question I have is, can we only apply for one of the PARs you listed earlier? Kelly, why don't you take that one?
Sure. So as Gurvanit said, and we have a slide there, the 4 that are listed on the NOSI are the only ones that are accepting applications for the NOSI. So there are 3 R01 PARs and 1 R21 PAR. Now, if you find that one of those don't suit your needs, for example, all of the R01 PARs are for clinical trial only or clinical trial required. So, well, actually that's not true. I think there is a clinical trial optional one. But you know, as Gurvanit and I have discussed, if you have a good idea and these PARs don't seem like they're a good fit for you, their timelines aren't a good fit for you, by all means, come in with your telehealth application under one of the omnibus solicitations. You just wouldn't tag the NOSI or cite the NOSI as part of that. And that's okay, because we do have a portfolio of telehealth research that has existed without this NOSI. But this is just a way of, you know, stating that we have a special interest in this topic, and there are 4 good PARs that are, you know, a good option for these applications. And so if you're going to come in through the NOSI, use box 4B to cite the NOSI and have them sort of included as part of this initiative, then you have to use one of the PARs that's listed.
Thank you, Kelly. The next question that we have is a need for a clarification. Is it an NOT CA 21043? Is this an R21? Can you please clarify that? Gurvanit, would you like to take that one?
Sure. So just to provide more depth to what we've already said, the NOSI, it's an interest from the NCI. It is a notice of special interest. So it's just a way of flagging an area of research that is of interest to NCI. It is by itself not a mechanism to apply for. So we have tagged 4 different existing funding opportunities, and those would be the ones you would be applying for if you were to choose to go through the NOSI route that we listed.
Thanks, Gurvanit. Yeah, I'll just add NOSIs are sort of unique because they're stating interest, but they point to existing funding opportunity announcements or PARs. And as Gurvanit said, they're not in and of themselves a mechanism through which to apply. Hope that helps.
Thank you. We have another question. Can we apply for this if we have a K award?
Well, so Gurvanit, I'll start, and I'm less familiar with this topic, but I think it would depend on which K award you have, and if it restricts, if you're not allowed to have, you know, additional funding, then this would certainly apply to that rule, but it just depends on which K you have.
I agree. I mean, I think anyone who has a K award and is thinking of applying for an R21 or an R01, that is great news, because that's the whole point of having a K award, is to have scientists being mentored from the junior career stages to a more senior status. So that would be wonderful. But just like Kelly said, you know, be mindful of both your time and budget constraints of the K award, and what else you can tack on. Now, maybe your K award is expiring and ending, and then you're thinking about the future, then that's fine. But just be mindful of your existing funding commitments and time commitments.
I think we're just gonna wait a few more minutes to see if we have any other questions coming in. I think we may have a few people who have dialed in and do not have the option to type in the chat. So if it's okay with you, Kelly and Gurvanit, if they could unmute themselves and ask the question.
Sure.
Yes.
For those of you who have a question and are unable to type in the chat, please feel free to unmute yourself and ask your question. And while we wait for that, I have another question in the chat. It says, our planned provider patient-focused telehealth intervention fits within the scope of interventions you identified, targeting primary and secondary behavior change. However, the intervention is implemented by health educators, usually MPHs and RDs, not professionals traditionally considered as providers. So for instance, MDs, DOs, and NPs. Are we eligible to apply? Gurvanit, would you like to start?
Certainly. So I would like to have more details before I give a more definitive answer. But in general, we are focusing on the technology, not so much on the exact provider. So, depending upon the nature of the provider interactions, we at least had a very broad view of the clinical team. So it could be physicians, nurses, dietitians, PAs, any and all, I think are part of the care delivery team. And to the extent that the technology of telehealth is being used to improve communication, coordination, and improve the quality of care, it certainly would fit within what we have envisioned for the NOSI.
I agree.
Great, thank you. We have another question that came in. If you could clarify what you mean by standalone mHealth studies, which are described as unresponsive.
Sure, I can start. So we have a lot of text messaging or mobile health studies where people are doing a technology mediated, intervention through mHealth with a certain population, and we fund those types of studies all the time, and those are certainly of interest to NCI. But within the context of this NOSI and this funding opportunity, if there's not a direct link back to oncology related care or to primary prevention of cancer in a telehealth context and in a healthcare delivery sort of setting, then it would be considered out of scope for the NOSI, but certainly of interest to NCI. Gurvanit, would you like to expand on that?
I agree. I think what we're trying to distinguish here is, by no means we're not trying to provide the impression that do not do mHealth research that empowers the patient, supports the patient. Absolutely, that is an important area of research. It is just the question for this NOSI, and what we are trying to support and encourage is the connection between the care delivery team and the patient. And so if there is a standalone, and that's what we were trying to get through with the standalone, is it is standing alone or standing away from the healthcare delivery system, and there's no interaction with healthcare delivery. There is no feedback loop or communication of the results back to healthcare delivery, then that would be standalone, and that's something that is out of scope.
Thank you. We have another question. Will reapplications be considered after the NOSI expires?
Yes, that's the beauty. I can say answer. Sorry, Gurvani, if you're going to jump in. That's the beauty of a NOSI that points to different PARs. Even if the NOSI has expired, all of the PARs that we've identified accept new applications, renewals, and resubmissions. So even in the absence of a NOSI, you could certainly put in your resubmission and it would still be considered for funding. Absolutely.
Great. We'll just wait a few more minutes to see if some other questions come in, but Kelly or Gurvanit, do you want to mention anything about if applications come in with a large budget or something, do they need to be contacting you first?
Absolutely. So the same rules apply for NOSIs as they do for all of our PARs, which is for R01s, if an application is going to be over 500K, they need to have pre-approval for that through a process called awaiting receipt of application, or ARA. And, in the current budget climate, we really discourage that. But if you feel like, the needs of your study justify having a higher budget, you would certainly need to contact Gurvani and I first, and we can walk you through the ARA process for getting approval for that budget prior to submitting.
Great. We have a question regarding the P50 FOA, telehealth, and cancer care. In it, there's a requirement to propose a pragmatic centerpiece trial and conduct 2 pilot trials. However, it's not clear if one or both pilot trials are identified and detailed in the application. Would you know what's expected, or would this be a better question for the identified FOA contact?
Yeah, I think that's probably a better question for Roxanne Jensen and Robin Vanderpool, who are the scientific contacts for the P50 RFA.
Thank you. Here's another question. Are implementation or effectiveness aims more appropriate? Gurvanit, would you like to start?
Certainly. I wouldn't say I wouldn't comment on being more appropriate. I think it goes back to what is the question that is being answered. If the question that is being answered is an effective intervention that you are, for hypothetically, trying to scale up or to a different delivery setting or other delivery settings, and it has an implementation focus, that's absolutely acceptable and within scope. If the question is trying to understand the effectiveness of a new telehealth intervention, then that's also of interest, but then that's one step before the implementation question. So depending upon where the science is for the particular intervention that is being considered, implementation would be within focus.
Great, thank you. Is the NOSI interested in quality assessment and evaluation of care delivery in telehealth? Gurvanit, we'll have you start.
Yeah, so the evaluation of care delivery, and again, evaluation can be at multiple levels. So, I'll have to know a bit more to give a more detailed answer. But the evaluation could, for example, be process improvements. So that's one way of looking at improvement in outcomes. It could be health outcomes of a patient. It could be efficiency outcomes of in terms of the number of interactions that a team has and communicating with the number of patients. So that could be evaluated, or it could be system outcomes. Whether it's efficiency, time, costs, other things that the system is doing. That is being improved. So the evaluation can happen at any one of the levels. So I think depending upon what level you're focusing on and what the outcome is, that would inform the outcomes of the evaluation.
Thank you. And there's a follow-up. I'm not sure if it's a comment or question, but it says evaluated on Institute of Medicine domains of care delivery.
So yeah, I don't have the ready reference to that, but in my mind, for the evaluation piece, it would be, as we're trying to improve care delivery, that's at least one of the areas of focus here. So the quality of care delivery, whether it's the patient-centeredness, whether it's the efficiency, or increasing the effectiveness of an intervention, all of those would be within scope.
Thank you. And we are at the 1:30 mark, so I encourage all participants who have any follow-up questions to please reach out to Dr. Blake and Dr. Randhawa anytime. And we thank you very much for your time and attention and wish you a good afternoon.
Thank you, Mimi and Larissa. Thanks, Gurvanit.
Thank you, Mimi. And thank you, Kelly. Bye-bye.
Bye.